Thank you all for joining us today what I'm hoping is for most of you a sunny Thursday. For any who don't know me yet, I am Alex Cobble-Chantren. I am Medtech's Integrations Program Manager. And today we have with us Dr. David Moeller and Jean-Philippe Héret from Adjutant Health, which integrates with Medtech Evolution via our interoperability platform, ALEX. That was not named after me. That was just a very fortunate coincidence. Adjutant Health is a unique offering designed by clinicians for clinicians, so I'm sure there will be lots and lots of questions and lots of great feedback coming up throughout the webinar. As these crop up, please feel free to pop those into the Q&A box that you should see down at the bottom of your screen, and the team will aim to get as many of those sorted as possible before the end of the session today. In the event your question is not answered in the webinar, as sometimes happens when we have lots of questions coming through, we will ensure that we get all of the contact and question details sent through to the team following the webinar to make sure those are followed up. And of course, for anybody who have any colleagues, associates, brothers-in-law, who knows, who are really interested in attending today, but for any reason couldn't fit it into their schedules, we are indeed recording this session, including the question and Q&A. And so we are, of course, happy to pass that along to anybody interested after the session. So we're not here to listen to me, so I'll pass over to Dr. Moeller. Take it away.
Hi, everyone, and welcome. Thanks for taking time out of your certainly busy days for joining us, hearing more about YIHA, your intelligent health assessment, an option to review patients and reduce admin time that is needed by the clinicians. I don't do these presentations a lot, so I hope you're patient and gentle in your judgment with me. I thank you in advance already. So I promise I will do my best that this won't be one of those one person talking to a screen kind of sessions. I really want this to be practical and real and hopefully useful for your everyday work. So before we begin, I really need to thank Medtech, especially Alex and Prashant and their team, and Steve, who worked with JP from Adjutant to set up the integration, which is, I think, a great step. JP is here today as well, and he'll help me with answering any technical questions. Yeah, let's get started. So my name is Dr. David Moeller, and I'm currently a GP and the CEO of Adjutant Health. I initially trained and worked in Germany before moving to New Zealand in 2019, and in 2024, I also completed an MBA because I've always been interested in how clinical and business systems can work better together to make care more efficient and sustainable for the clinicians while being patient-centered. And my good friend and co-founder of the company, Callum, shares that same goal, and he's also a GP and serves as clinical director in Glasgow. So he's asleep now, he's not here today. But he's also a bit more than a hobby programmer, so that what got everything started. And with what you'll see today with YIHA is a lot of what comes from our combined GP perspectives. So the name adjutant comes from the military, and an adjutant supports senior officers so that they can focus on leading and strategizing. And that's exactly what we want to do for your healthcare teams. That's why we founded the company in the first place. So with YIHA, your intelligent health assessment, patients fill out digital forms that automatically transfer into their inbox, into their daily record, and into their patient dashboard in Medtech Evolution. So it saves a lot of time, reduces admin significantly, and I can vouch for that. I've been using it in a different form without integration for a while, and patients like it because they can complete the review and supply the information in their own time. So here's what we'll cover today. I'll show you the idea behind YIHA and how you can try it out even after the webinar for yourself, do the forms yourself. And I'll show you 2 example forms and how they integrate directly into Medtech Evolution. So YIHA grew out of something Callum and I kept noticing in general practice. Clinicians were and are spending a lot of time on administrative work, time that we think could be used for patient care instead. And so that was the key reason that we founded Adjutant Health in 2023. And as you might be aware, the Royal New Zealand College of GPs workforce survey from 2024 has highlighted 2 worrying problems, 2 worrying trends that are aligned with our goals. So 70% of GPs still report moderate to high levels of burnout, a bit down from 2022, where it was 79, if I recall correctly. But 17% of GPs are also 65 years or older. So 2 separate issues maybe, but together they make one point very clear in my opinion. And that's GP scarcity isn't going away anytime soon. So we need to make GP work more efficient, sustainable, and maybe enjoyable for the colleagues to retain them in the workforce, and obviously while maintaining quality and safety. And so YIHA is designed to help with exactly that. There's three different parties who benefit from YIHA, in my experience, and it's the patients who want timely access and continuity of care. That's something YIHA can help with. Then the clinicians, such as myself, want to work safely but with manageable workloads. And obviously, third, the practices need financial stability while maintaining quality and efficiency. So obviously, the medical council plays a role there as well, with the requirement of regular reviews for safe prescribing. So that's something that YIHA helps with as well. And YIHA does that by collecting structured, relevant information, so that clinician, nurses, and GPs alike can focus on the clinical part and not the paperwork. The YIHA forms are designed so that patients can easily understand them. No medical degree is needed, obviously. We keep them short enough to be convenient and long enough to ensure patient safety. And we designed them to be intuitive and optimized for mobile phones so that patients can fill them out anywhere and anytime. And they do that as well. They can be used and filled out on normal computers as well, obviously. They use very little mobile data so that with the goal of keeping access simply and affordable. The homepage that patients see is custom branded for your practice with your logo, your colors, and your layout, so patients know immediately it's trustworthy and official. And I'll show you an example. So Totra Health in Hastings is using the forms, for example. Oh, I'll need to share the screen. Give me a second. What did I do? Put this over here and share. So I think you'll be seeing Totra Health homepage at the moment. So this is what Totra Health looks like with their logo, and then the equivalent YIHA forms. The asthma review, as an example, has the same coloring, the same logo, and we use that to give the patient the sense of trustworthiness that it deserves. Just stop. So so there's a few ways that the patient can access the forms. What they need is the link, and the link can be sent to them any way that you can imagine: text message, email, patient portal. You can put it on the homepage if you want, and then they can access it from there. Especially interesting for the admin forms, like for off-work certificate requests, for example. I'll show you that as a second example in a moment. YIHA does not use any artificial intelligence, no AI whatsoever. So we do that on purpose. We want the clinicians and the patients to stay in control. We want to improve the efficiency, but we want to leave the clinical decision-making always in human hands. And what is important as well to know is the data is completely, entirely processed in New Zealand. So the server is a virtual server in Auckland, and so it never leaves New Zealand at all, any data that they give us. Important to notice as well, all YIHA forms is not like we invented the scores. They are all internationally recognized evidence-based scores that we use, and frameworks as well. And that means obviously that the data aligns with the established practice, and we just make sure it's clinically reliable and structured. So I will show you another homepage now. I'll show you the Adjutant Health homepage. And this is where you can find the demo forms as well. So if you click here on the demo forms and you want to try out the forms after we're done, no problem. So you'll see all the forms that we have available: autism, ADHD screening, WHO disability score to support ACC and WINS renewals, then the average home blood pressure. So instead of having some unreadable scribbling on a piece of paper and then having to do the average yourself, the patient fills out the blood pressure form and you receive the averages for morning and afternoon readings and the overall average, and it all goes into the daily record and the patient dashboard. Asthma review, that's the one that I'll show you next. And then we've got the COPD depression anxiety review, hormonal replacement therapy, and oral contraception review. And at the end, I'll show you also the admin forms, but one in particular, and that's the off-work certificate. We've got the staff blood pressure averaging, which is a bit of a gimmick. So you enter the readings instead of the patient, and then it gives you the average, so you don't have to put it into a calculator, and it goes through as well. So when you complete one of these forms, then obviously they are not integrated with Medtech because they are test forms, they are demo forms, but you will receive a PDF copy of the form, of the information that you, to test it out, entered. And the email address is what you supply at the beginning of the form. That's the only difference. So I'll show you in the live Medtech environment now how it works. So we'll go to our how to do that again. So reload. So this is the asthma review form, and we've just used the Adjutant logo here in our Wonder practice. So the reviews always start with some information regarding the condition that we are going to review. You can see the information, the first tab here, regarding asthma in this case, as an example. The next thing the patient does is click on the review tab, and then we will be using Charlie Brown today as our test patient. And this would be the patient filling out their details. And that's the NHI is what it is linked to. It still says optional, but it should be mandatory, and that's going to be changed soon. It's just at the moment with the PDF, it was still optional, but now with the integration, it's going to be mandatory soon. What's also going to be mandatory soon, but not for the presentation today, but that's going to be changed as well, is the date of birth. So the NHI and the date of birth need to match. And there's a third layer of security, so the information doesn't go into the wrong patient's data, wrong patient's file, and that is the HPAF. So the facility ID that the practice is connected with needs to match. So the person filling it out needs to be enrolled in the practice. Patient fill out their details. They can choose the practice. If you want, you can have the different doctors, nurse practitioners who work for you, or the pharmacist's name in a list. But that's more for your information if you want to know who the patient chose, and because it goes into the provider the patient is enrolled with automatically, unless you want us to send it to the YIHA provider, which is something you'll set up. So instead of a doctor or a nurse, YIHA is one of the new providers in the practice then. And so this way we can write notes into the daily record. Patient has to confirm that they enrolled with the Adjutant test practice in this case, but that would obviously be your practice's name, and that they're old enough and that they agree with the Privacy Act data process. So then they click next. With the reviews, there's always the review of their alcohol consumption. If they click never, it just goes forward. If they click that they do drink, then there's information on how they might want to cut back. There is a standard drink guide that they can look at so that they reliably fill out how many drinks they have and how often do they have 6 or more. And you might know this from when you review their alcohol, smoking, or vaping on the patient dashboard directly in Medtech Evolution. Those are the same questions in the same drop-down menus. So if they never smoked, then again, it goes on. But if they did smoke, then they can hear more about quitting and what positive effects it has. They can click the link so to be provided with some information from Smoke Free New Zealand and their local service. If they are interested in more information regarding weight loss, and you've got the BMI here, you've got a general information about the BMI that they may click on, they don't have to. And then there is also links, and after they've read more about their BMI, that takes them to the official Health New Zealand Te Whatuora homepages to get more information on how to stay healthy and lose weight if they want to, for example. Then these 5 questions will certainly be familiar to the clinicians amongst you. Those are the 5 questions that make up the initially by GlaxoSmithKline SmithKline developed asthma control test, and those are the points that you always want to have. 25 is the best outcome and 5 is the worst. So 1 point per question would be the worst. So how often did you wake up in the last 4 weeks, once or twice, and so on. So these questions will certainly seem familiar. So I don't want to spend too much time and waste your time on these. Because the interesting part comes afterwards, because these are the questions that, well, maybe clinicians should be asking to ensure a safe review and safe prescribing, but maybe out of time pressure, it happens less often than ideal. Because, well, in my experience, the patients, sometimes they come in for an extra appointment to get their asthma reviewed, but that's rather seldom. So often enough, it happens that they came in for something completely unrelated, lower back pain or whatever, and that's sorted, and then there's 2-3 minutes remaining, and then the question arises, do I open that can of worms and do the asthma review that's overdue for 3 years, or do I maybe send them a text with a link to the YIHA form so that they can fill it out, and then I get the results. So they give more information if they do have an asthma plan, are they under hospital care, they can put in triggers for their asthma. And this next page is about the preventative inhaler. So if they click no, then it's just the next page. But if they do click yes, then a plethora of options opens up. So then they get more and more questions about how they use their preventers. And if you look at this space here, then you'll see whenever I click the type of inhaler that they use, a link pops up. It's NHS videos for their specific inhaler, and it gives them instructions. So it gives them information specifically for their inhalers that they use. If they untick it, it goes. And if they tick it again, it shows up again. They need to confirm that they did watch the videos, so that's not optional. And if they want a member of the practice to assess the technique, then they tick that as well. And you'll see that in the PDF then and in the daily record. Then they click next. The next and almost last slide is about what do they do if they have an exacerbation. And again, they get options if they click one of the options that they use. So exacerbations in the last year, no, then they could go on. But yes, let's say yes. So we had 3 exacerbation and 2 required steroids and 1 required hospital admission. And then there's next. Every form always ends with the option for the patient to ask for a review, and they then will have to contact the practice to arrange it. But obviously you would see it as well. And if you want to, then you can obviously get them in. What's important to know, 8 out of 10 patients who fill out the asthma review do not need an appointment. So that's what I looked at for my MBA thesis and, thesis. And they, so only 2 out of 10 patients then need to be seen because they have a asthma control test score of 19 or below. So let's say we're happy without further discussion, and then we submit it. And because it's all in New Zealand, it's quick. So that was it already. And this is where the patient can, if they want to, optionally give us a feedback, and we score 9.5 out of 10 points consistently. And my favorite feedback so far was easy to use even for an 83-year-old. And well, it doesn't, not all 83-year-olds will be happy to use it, but obviously at least one of them was. Then I will now bring this up, and this might look familiar to you as well. So this is Charlie Brown here, and we just entered the NHI, so that's how it's identified. And Charlie Brown is a patient of our Wonder practice, of Adjutant test practice. So if we open the daily record, then you can see report generated 30th of October 1318. And if we look into the inbox, you'll see the PDF that we just generated. So there it is. So these are the previous ones, home blood pressure and whatnot. So this is not the first time that Charlie Brown fills out a form. And you can see that's what we just filled out. So here are the results. What I can't show you, and that's because of the test environment not allowing it, so I don't have a patient dashboard. So I can't show you what it looks like on the patient dashboard. But what happens is the integration takes these information and puts them into the screening for weight and the blood pressure from the other forms as well when it applies, weight, height, BMI, and puts it into screening, as well as the asthma control test score result and the COPD test. And that goes into the patient dashboard. The smoking, vaping, and alcohol status, they go into the classifications and then have a note on the patient dashboard, just as you know. All right, so I'll put this away again. Oh, that's the wrong one. Where's my other click? Sorry. Just getting it back. Just got to find the right homepage again. There it is. Okay, can you see that all right, Alex? Same. Cool.
Yep.
Okay. Because I also wanted to show you the off-work certificate. The off-work certificate, especially in the aftermath, is for me the pinnacle of a time waster. So the patient rings up, healthy patient, 25 years old, rings up and says, I had diarrhea last week. I'm back at work for a day, 2 days, but my employer wants an off-work certificate. So, and that takes so much time out of the admin staff. They need to call, they need to take the call, they need to identify the patient, they need to pass it on to a nurse or a GP. The nurse needs to ensure that everything's correct, and then the off-work certificate is done. What if the patient clicked a link that's supplied on the homepage, or at least we save the time that the nurse usually spends or the GP spends doing the off-work certificate on the phone with the patient by the receptionist sending the text with the link to do the off-work certificate. So prescription request, leave a compliment, raise a complaint, or request access to notes. That's another option here with the admin forms, but I'll show you the off-work certificate if I may. So name again, let's take Chuck Brown. And then you've got triple Z. So 1, 2, 3, 4. And this is the email that the patient supplies. So the patient where they want to have their off-work certificate sent. And I can't take the adjutant email address. That's the only email address it won't accept. So that's why my Gmail address is in there. So, well, is it a first certificate, or is it an extension, or what is it? Did you talk to did you talk to some clinician? Could put the names of the practice GPs in there, and which day would you like this? Well, let's stick with 27th of October, so 2025. What's the first day? And we want it to be until yesterday, 2025. And we as a patient, do we want it emailed? Do we want it to be texted, or will the patient collect it from the reception? So we'll want it emailed. Have you certified for the first 3 days? Yes, no. Please provide your job title. Well, GP, work duties and hours, everything, all the time. And what is the reason you cannot work? Well, I'm tired. And has it affected the duties? Yes, absolutely, very significantly. So just making up an example. And submit. So if I then bring back Charlie Brown in the environment, then you'll see, hang on, need to go back out of the inbox. We could switch the patient as well. So there's the off-work request here that we just generated. You know, see everything all the time. I'm tired. And then you've also got the inbox here. Oh, sorry, there it is. So full screen. And that's a PDF, that's a normal PDF. So, and obviously, if you are suspicious of two things, maybe if the patient maybe it's not correct, so you might want to ring the patient. You can always pick up the phone and talk to the patient. Obviously, that's if you deem that necessary, no problem. Or if you have someone with inflammatory bowel disease who's got diarrhea and you think maybe it's a flare or someone needs help there, and it's not just a healthy 25-year-old with resolved diarrhea after 3 days or 5 days or whatever, then you might want to talk to the patient, and you can feel free to do that. So on a day-to-day basis, maybe I was able to show you, just gonna stop sharing the screen now, how you can reduce the time that you need for administrative tasks. I'm sorry, I'm fighting with Zoom. So there you are. How you can reduce the time, and obviously what are you going to do with that saved time? So you could reduce the appointment wait times to help the patients get their timely care that they like so much, or you can enroll more patients and increase the practice's financial stability maybe without adding to the workload. We suggest that you recover the costs for YIHA, or parts of the cost at least, by charging the patient for the service of reviewing their request. After all, it does replace a telehealth appointment, especially with the off-work certificate, for example. So instead of getting verbal information or the patient sending the information via a patient portal, unstructured and not delivered in a concise way, how long they've been sick or whatever they requested. So there is a way to be reimbursed by the patient. And I think what might be interesting for you as well to know is there are multiple. We had a look at the available applets, and there is a lot already. But everything that's repetitive and where the patient needs to provide information is obviously a good course for YIHA. So at the moment, the plans are to have a cardiovascular and diabetes review form. What I would like to have quite soon is a medical history taking for the registration, the enrollment of patients, so that you don't need a new patient appointment for someone who's otherwise healthy, or you can assign the provider of the patient based on which information they provide in the medical enrollment. 6-week baby checks, the driver license renewals, other questions, how many accidents did you have in the last 5 years? The medical history before skin checks and mole scans. So do you have a family history of skin cancer? Do you have one yourself? How much sun exposure did you have? Then I want to have something that's WINS and ACC form dedicated, so something that's helping with the renewals of ACC 18 forms. And well, an online wellness check is something I would like to have as well. And last but not least, not a form, but something that we're trying to fix quite quick and set up quite quickly, is that the patient is able to fill out the form in a different language, because they are so standardized and they are international scores. So Tereo or Samoan or Hindi or Easy English, for example, as well. Well, the forms are not complicated in their communication, as you've seen, but to make it even more optimized for access for all patients. And then obviously the clinician, you don't get the responses in Hindi, you would get them in English, right? So that's the idea of it. And another thing that is in the pipeline is that we can give extended data insights into what's happening with your patients. So at the moment, obviously, you can run an audit and you can see that the 50 to 60-year-old women with their asthma are not as well controlled as the men, or different ethnicities, or whatever you like. But you don't know why. But with the YIHA forms, the patient gives you the information. Maybe it's because they don't have an asthma plan, or maybe they do the wrong thing when they have an exacerbation, or they don't know what to do. So all the things that are not included in the number on the dashboard at the moment, that's something YIHA could give you as an information, obviously. And it also goes a bit further, because with ADHD from not February, next year sometime, when GPs will be able to, was it July? we'll be able to start methylphenidate for a patient. So the ADHD screening is going to be interesting and more demand, we think. And the mental health, anxiety, depression. So you get all the information. For example, what I do at the practice is if I book a patient with a counselor for their depression, and I'm seeing them in the appointment, I say, your appointment is in a week. I sent you a link. Please fill out this PHQ-9. It's going to help the counselor to know your depression severity when you see them, instead of the counselor having to go through the questions in the first 20 minutes or however long it takes. So the idea of YIHA, as you may have seen, is connecting the patients, clinicians, and the system, and we want to make it secure and simple. So that's the whole objective. So and if you have more questions on how it could work for you to save time and support your safe prescribing, I would be glad to answer them. And JP can help me with all the technical stuff that I don't know anything about.
Okay, we do have a few questions in the Q&A box. We've got, can the platform invoice or collect payment from the patient?
No.
Okay. Does it just
Easy
go
answer.
into the patient inbox, or does it also go into the provider inbox?
It goes into the provider inbox. So you can choose per default. It's set to go to the provider's inbox. That's the PDF.
Mm-hmm.
And the other option is because one of the requirements that we have, one of the technical requirements, is that you need to set up YIHA as a provider in your practice. So as if you have a new nurse or a new GP joining you, you would usually set up an abbreviated form for that, and that needs to be YIHA. I hope that's not taken as an abbreviation in the practice yet. So and then this can either go into the provider the patient is enrolled with inbox, or into the YIHA inbox if you want, for example, one dedicated person to look after all the YIHA. So that's another way to save GP's time and use the resources of staff who's more readily available. So if you have a nurse who wants to do all the YIHA once a day or so, then that would be an option as well. Then they can access the all the YIHA forms then.
Okay, we do have
And
some.
yeah, I think that was the question, right?
Yeah.
Good.
So we do
Sorry,
have
I got carried
a
away a bit.
series. We do have a series of technical questions here, and in just in case we can't answer all of these in the webinar here, just a heads up that of course we will absolutely be answering all of them after the webinar, if just in case any of them cannot be answered directly here. So what is FHIR API security? FHIR R4 versus R5 discrepancies causing dropped or mismapped fields.
Yeah, well, I suppose that's a question for me. Hi everyone. Well, the first question, I mean, I'm looking at Alex. I'm looking at all the other questions in the chat, and I feel like there are plenty of questions that would be of interest of many practices and GPs. This is very, very technical, right? And I think that it may be with me answering offline, but just very, very quickly, because I don't want to dodge the question. On the first one, this is more a question for Medtech, because we are obviously relying on Medtech APIs. The second one, that's also partially on the Medtech side, but that's like a common answer that we need to provide. So also that's not easy to answer live. The fourth one, we've already answered this question. Well, David already answered this question. I mean, we are hosting all the data here in New Zealand, so there is no such cross-border data flow challenges really that we need to solve at the moment. Yeah. Sorry if I wasn't.
Okay.
Is that okay?
So Yeah, that suits.
Yeah.
And these are quite technical questions, and from the medtech side, I won't be probably the most appropriate person to answer them. So what we'll do is we'll take that one offline, and we'll make sure that we get that is an anonymous attendee. Feel free to, if you wish to get some answers directly, please feel free to email the Activate ALEX at medtechglobal.com email address that I will share on the screen at the end of the webinar, and we'll be happy to go back to you with more detailed answer, if that helps. All right. Does the Adjutant homepage list all available forms, or is it just a sample of what's currently available?
All the forms that are in the available applets or the demo forms are the ones that are available at the moment. There are some sub forms, as you know, there's anxiety, depression, for example, and obviously that is two separate forms. If you want to do it, or autism, ADHD, you can answer both questionnaires or only autism and ADHD. And with the admin forms, well, it hides 4 as well, 5 in the admin forms.
Okay.
So,
how does the
Yep, sorry.
How does the Medtech integration handle mismatches, e.g., incorrectly entered name, DOB, or NHI? And at least from the Medtech side, go for it.
No, go ahead. Sorry.
Generally speaking, how this would present an adjutant, we obviously have some search parameters around to make sure that we've got the right patient. So essentially, where a combination of certain data points, so that's going to be things like the first name, last name, date of birth, NHI, those kinds of things. We essentially throw an error, but how that presents for adjutant, I'll leave that to Dr. Moeller.
Yeah, so we don't take the name, first name or last name, because with all the apostrophes and then preferred names and nicknames and whatnot. So we have and I think I briefly mentioned it before. So we have the patient needs to be enrolled with the practice. So the homepage is linked to the practice, and so the HPIF, the facility I needs to match. Then it's the NHI that needs to match, and then it's the date of birth. So, and if that doesn't match, then there is an email to info@adjutant.health. So that goes in. We get an email that something has not gone through, and then it needs to be reviewed. What's happening? So we want to make sure that not the wrong patient gets the data. So, but you know, a patient typing the wrong NHI enrolled in the same practice with the other patient and the same date of birth. So those are the 3 identifiers. Very slim, I assume.
Okay. From Josh Griffiths again. Many of our patients don't know their NHI. How do you anticipate managing this? Since you mentioned the NHI was mandatory. Good question.
Yeah. So they'll see it on the patient portal if that's the way they get the link. And the other option, how we handle it at the practice, is there's template text messages that are set up under the short code YIHA, and then there's YIHA asthma. So there's YIHA asthma 1, YIHA asthma 2, and the YIHA asthma 1, for example, is a nicer one. We've realized you're overdue for your review. Please fill this out. Your NHI is ABC 1234. You will need it for the review. And the number and the asthma review, YIHA asthma 2, is something you wanted a repeat prescription. We cannot guarantee repeat prescriptions without making sure that the therapy remains appropriate, for example. So asthma as an example again. But put it into, so there will be some point of contact unless you put it on the homepage, which I would only recommend for the admin forms anyway. So either the patient calls up and says, I feel so depressed, I need an appointment. Then the receptionist can say, I've booked you in for a week, an appointment for in a week. Your NHI is ABC 1234. Please fill out the link that I'll send you, or you put it in the text message. And that obviously gets automatically generated by Medtech. If you put, what are the brackets called? The brackets, then you put the NHI in there. It's just like a name, right? Hi, Alex, your NHI is ABC 123. Please fill out this link. Sorry, that was a very long answer to a short question.
Yeah, we like detail. We like it. And we have 2 questions about what the costs are for practices.
Yeah, so with the integration, it's $1.78 per enrolled patient per year. So that adds up to 8,900 plus GST for a 5,000 patient practice, roughly. And we do have, however, we do have an offer. This is where my very little marketing mind might have to come in. So if you sign up before the end of November, we give it to you for $1.07 for the first 12 months, and $1.07 comes from what the cost was, or the cost is without the integration, just to receive the PDF in an email. And that does not include the data. So that's maybe I was got to, if you want to know, if you want to be able to compare it, it's something separate, but 178 per patient for the year forms. Per enrolled patient per year, not per usage.
Okay. How do staff fill out the staff BP form?
You click on the form, and then it's just like the home blood pressure measurement form that the patient fill out. The patient fills out. It's feel free to try it out. So just on the demo form, so you just fill it out, and then you enter the address where it wants to go to.
Okay. Are there
So so obviously, sorry, maybe I should, maybe the application. So if the patient did not fill it out themselves at home and they come in with something handwritten, then you might want to use the staff BP form. But as I said, I mean, it's just a giveaway, a gimmick a bit.
Are there preset generated forms, or do we create them from scratch?
No, the forms. So we create the customization for your forms. So we make sure that it is trustworthy for the patient. So you have the home, let's say your practice is called East Coast Practice, then it will be eastcoastpractice.yiha.nz that the patient will click on, and then they'll see the logo, and they'll see the color scheme of your usual homepage, and we set them up for you.
Okay. Does the patient have the ability to bypass the general information, so alcohol, smoking, etc., before filling out the more specific information, e.g. ACT?
That's very funny, because that person has the same name as a very dear colleague of mine at work, and she's the one who told me not to crack any dad jokes today. So I've been holding myself together very, very well. No, they can at the moment not bypass the information. They need to fill out the smoking and the other review. So it is theoretically possible to set that up if a practice wants that. So please check your head if I'm wrong, JP, but it is possible to customize that if a patient only wants them to fill out the asthma form. But that would be something general then, right? Or we can set up a separate one and say asthma without and asthma with. That would be a different link then. So that would be possible. Is that right, JP?
Yeah, sorry, I was on mute. Yeah, totally. Yeah.
Cool. Thanks for your question, Jenny.
All right. And please, can you share the demo details again? And I will also shortly be putting up just a cheeky PDF that'll include our contact details as well. So just in the event that you would like a recording of this webinar or any other webinars, that kind of thing, you can always contact us at that email address for any questions that we can help with. We're always here to help.
Yeah, I've just typed in, so adjutant.health. So I've just typed it in there. So adjutant.health, and then you'll see the demo forms right there.
Okay.
And all the other information, the pricing and whatnot.
All right. So hopefully everybody can see that. So just in case there are any last questions that might be coming through, just feel free to pop those in there. And of course, we do have a couple of questions that we will be looking to follow up on. But as I said, if for you have any questions about this webinar, you want a recording of it, how to get involved with Adjutant Health, anything like that, you can always feel free to contact us here, activatealex@medtechglobal.com, and we'll always be happy to help however we can. This QR code here does just link to our partners page, where you should see Adjutant, I believe, at the top, because that's just quite lucky alphabetical ordering there. So it looks like we don't have any other questions coming in. So thank you so much, David and Jean-Philippe, for joining us today. We really do appreciate it. As I said, it's always exciting to see these integrations coming through, especially when they're designed by GPs for GPs. It's always such an exciting thing to see. So we're looking forward to hearing what everybody thinks. In the meantime, thank you all for taking the time out of your busy days to join us. We really do appreciate it. Primary care is time is not exactly an abundant resource, so we do really appreciate you taking the time to spend it with us. And with that in mind, thank you so much for joining us, and we hope you have a great rest of your week. Thank you.
Bye-bye.